One of the other things the book covers is victims of domestic violence and potential complications for obstetric care, which I know you know a lot about, Dr. Barron. How can you detect domestic violence, or how can you detect the possibility of that someone may be a domestic violence victim, and what are some of the potential obstetric complications for victims of domestic violence?
Well, in the research, it doesn't matter which domestic violence tool that you use; they all work about just the same. But it's important that that tool be used. And when I was looking into it, I feel very passionate about advising women because of an early experience that I had with a woman. I was seeing her at the first prenatal visit, and do understand that women are reluctant to share that they are being abused. And so she gave me some of the signs that I usually associate with a victim of domestic violence, but she wasn't willing to say that she was being abused. And so I went into a teaching mode where I described the occurrence of violence, which actually increases during pregnancy, and telltale signs in a relationship. And she began to nod her head, but there was nothing at the first visit. And then at the visit, she brought the partner with her. And it was quite evident to me that he was very domineering, very controlling in his behaviors that he demonstrated at that visit. And because there was no privacy with the patient, I was not able to complete my assessment. So the next time I saw the patient, she had already been to the emergency room. The resident had told me that she had complained of a vulvar hematoma. She claimed that she had fallen down the steps. And I was able to say to him, you really need to be asking her about violence. And so when he came to see the patient that day, he did do so. And sure enough, this man had kicked her and thrown her down some steps. And so it was a slow process, and I thought to myself back then, gee, I wish I had had some sort of screening tool I could have used right then and there. And so I've been interested. I've been a nurse practitioner since 1986, so I've watched the evolution of these tools over time. And so that's why I felt very passionate about including good information in the book on this topic that would be handy for nurse practitioners to be able to carry into a clinic with them.